Hello, everyone, and welcome. My name is Selena Belisle, and I am the founder and one of the board approved CE instructors here at the school, CE Institute. We teach primarily to nurses, massage therapists, and cosmetologists. We issue CE hours for those three boards here in the state of Florida, but we also teach NCB TMB approved CE hours in subjects such as chair massage. And during this brief video training, I'm going to show you a small unit out of our home study chair massage training. If you're interested in learning more about chair massage, hands-on application, and the business of chair massage, we have several chair massage workshops available at the school. They're either pre-recorded home study, which you can access right away, 24 hours a day, 7 days a week, until your course access expires. We also have live webinars and live in-person classes, and we're even published on the subject of chair massage as well. If you go to massagemag.com, this is an article that came out in 2022, and it's about how to use corporate chair massage to combat the labor shortage as an employment perk, which I've been doing for over a quarter of a century now, working at many different corporations, treating the stuff. And in this article, I gave some tips on how to set up a chair massage event. Right now, what I'd like to show you is a chair massage routine for headaches. Okay. Now, keep in mind, we're a continuing education school, which means we usually are teaching to people who are already licensed healthcare agents. Okay. You should not be practicing massage. Massage is part of healthcare unless you have a license to do so. And when we teach continuing education hours, it's to people who already have rudimentary training and precautions and contraindications and so forth. And you should also take specialized chair massage, whether it be from us or any other CE provider, about how to set up the chair and what to do with your clients, any special contraindications for them, HIPAA requirements with chair massage, and more, which we include in our chair massage training, because there's a lot of compliance that you might want to consider when offering chair massage beyond the hands-on application. So without further ado, let me show you what we show as a routine for hands-on. It's about 8 minutes for a headache. And if you want more hands-on, you can visit our YouTube station. We have some more free videos there, or you can take the whole training with us as well here at ceinstitute.com. Until we see you in a training, be safe. So here we are. We're going to get started with our chair massage for headaches. This is about 8 minutes hands-on for a 10-minute appointment. Our step one, we're starting with a circular friction with a temple massage, and you can practice this clockwise, counterclockwise, whatever makes most sense for you. You can see a client has the hearing aid on here. You might want to remove a hearing aid so it doesn't buzz and so forth, but that's your choice between you and your client. Step two is we're going to do the wave over the scalp. We practice this a lot in Lomi Lomi massage. You're just trying to bring some blood circulation, almost like effleuraging through the scalp itself. The client does not need hair to do this. You can be practicing on a client's scalp with or without hair. If the hair is really frizzy or knotty and you can't do that, then you can just skip the scalp, skip the waving and do compressions through the hair. Next thing we're going to do is a little bit of neck traction. We're pulling superiorly on the client's occiput. You can add in a little bit of massage here if you'd like. Step four, we're alternating palm compressions in the upper trapezius. Remember, we're keeping this going quite quickly. If you're booking 10 minutes, 6 clients on an hour, 10-minute appointments, you have about 8 minutes to massage the client and 2 minutes for sanitation and intake. So we're just alternating compressions back and forth. Easy way to use your body mechanics here, leaning forward over the client's front of the chair. And from here, we might start trigger pointing, step 5, with our elbow and trying to find trigger points in the trapezius, levator scapula, maybe even deep in the supraspinatus, and try and relieve those trigger points. Now, you'll only have time for just a couple trigger points when you only have 8 minutes to practice open, trigger point, and close. And we're going to be adding some myofascial work of the scalp here as well. But here's an example of where you would apply your trigger points in this little 8-minute routine for 10-minute chair massages. And you can use a dull or pointy elbow or whatever makes most sense for you. I usually like to hold trigger points for a minimum of 30 seconds, which is really hard to do in an 8-minute routine. From here, I'm going back and just kind of making nice with some more compressions of the upper shoulders before I start with my myofascial scalp work. The myofascial scalp work, you're inserting the palm of your hand and your fingers as close to the scalp as possible, then closing your hand, grabbing hair. You're going to twist clockwise until the client reaches about a 7. And then when they're at a 7, you're going to hold it there as long as they want to work up to a 7. Then you're going to relax in the opposite direction. We'll bring it back to a 7, and it doesn't matter if you rotate clockwise or counterclockwise first, but I would go in both directions until that 7 dissipates to almost nothing. Once you've dissipated from both sides, you're going to go to a new area on the head, and we're going to rotate clockwise and counterclockwise. Usually you're communicating with your client with this, asking them what their number is on a 1 to 10 scale, the VAS score, and allowing that to dissipate. Usually as trigger points are relieved and fascia is stretched as well. I call this the manual Imatrix or sumatriptan because as a migraine sufferer myself, when somebody does this over my scalp, I can feel like a rush of circulation, which is really nice because that's really what we're trying to do is have some vasoconstriction and vasodilation over the cranium to try and affect a migraine. So we've got the crown and top of the head here that we're working on. Now we're moving over to the client's left-hand side. And you want to make sure your palm is right next to the client's scalp. Okay, make sure you're not just pulling the hair. You should be on the scalp itself. You really want to twist that aponeurosis underneath the hair, underneath the skin. And feel free to move your body around the client so that you're using good body mechanics when you practice that. I'm coming back to some neck traction. We're going to repeat neck traction, which is number 7 on your little 12-step headache routine for 10 minutes appointments. Now I applied a little bit of unscented lotion and I'm petrissaging the cervical spine, giving a nice little neck massage here. This is number 8 on your routine. Doing some finger walking. This person has a first alert and a hearing aid contraption for, that's what those 2 necklaces are. It's a geriatric client. Sometimes you're working around equipment when you're working in geriatrics. So this is 8B, alternating finger friction from inferior to superior on the cervical paraspinal muscles. Back to a little bit of petrissage and friction through the neck here, just trying to get some ischemic compression where we're evacuating blood with compression, and when we release, there's a resurgence of circulation. Back down into the shoulders and some alternating compressions on the trapezius. Clients feeling good, pretty good now, and you can see us laughing and enjoying the time. I'm repeating some compressions in the trapezius now. You can repeat trigger point work through here if you find a hypersensitive area. With my elbow, notice how I'm just pushing towards the floor. I'm allowed to lean forward here. This is great body mechanics. Not a whole lot of physical exertion to do this, but getting some pretty good pressure. You can get some deep tissue in there by applying pressure in the correct direction, and that would be it, standing at the top of the chair. Now we're just doing some petrissage to the clothes, some petrissage and scalp massage. Step 11, back to temple massage. And we just kept that to really the upper body, cervical, and head area. When they have a headache, just upper body, very upper body. Now just a little bit of body brushing, wiping any negative energy from the body, and allowing the client to sit back and enjoy that process. So that is your 8-minute chair massage that you would do for a 10-minute chair massage appointment. The other 2 minutes would be sanitation practices and client intake.